Good evening, friends. Welcome to Health Trends Daily. It's Saturday, April 25th, 2026, and we have breaking news in oncology, public health, and a massive update on drug accessibility. Here are your top headlines. Headline 1, Head and Neck Cancer Awareness Month. Oncologists are urging the public to check for small, ignored signs as cases spike. Headline 2, World Health Organization issues urgent warning for Bangladesh regarding high measles outbreak risk. Headline 3, Massive Drug Price Reduction. Johnson & Johnson joins the Trump RX platform, offering key drugs including diabetes treatments at lower costs. Headline 4, Lifestyle Shift. New study suggests quitting tobacco could boost income for 1 in 10 Indian households. Segment 1, Cancer Care and Awareness. Focus, Head and Neck Cancer Awareness, April 2026. Key points. Oral cancers linked to tobacco and HPV are seeing a high burden in India. Oncologists emphasize that early detection, persistent ulcers, voice changes outcomes. Note, Vice President C.P. Radhakrishnan emphasized that mental strength and awareness are crucial in fighting cancer. Actionable advice, regular screenings and avoiding tobacco are the primary defenses. Segment 2, Global Health Alert, Measles. Focus, Bangladesh measles surge. Key points. WHO reports high risk, with 58 out of 64 districts in Bangladesh affected. Cases primarily affect children under 5 due to vaccination gaps, 2024 to 2025. Suspected death toll already high this year. Context. This highlights the fragile state of global routine immunization post-pandemic disruptions. Segment 3, Drug Prices and Policy. Focus, Johnson & Johnson J&J on Trump RX. Key points. J&J will sell diabetes drugs in Bacamet and Xarelto via the Trump RX platform in Johnson & Johnson Direct. This is part of an agreement to lower prices for Americans, reducing Medicaid costs. Context. This represents a trend of pharmaceutical companies voluntarily partnering with the administration to combat drug price legislation and tariffs. Segment 4, 2026 Medical Innovations, Quick Hit. Focus, Emerging Tech and Research. Weight loss, orforgliprin, Eli Lilly, first non-peptide oral GLP-1 receptor agonist gaining momentum, no injections. Cardiovascular, AI-powered eye scans are being used for early cardiovascular risk prediction. Medical device, Allergen Alert Mobile Lab, a portable device to detect allergens in food for allergy sufferers. The epidemiology of sudden cardiac deaths, SCDs, was turned on its head Thursday, with research showing that in reality, ischemic cardiac disease is not the leading driver of SCDs, as previously thought. From a prospective autopsy study of unselected deaths in San Francisco County, California, it was evident that out of 943 presumed SCDs, 62% were autopsy confirmed, and only 41% of those were due to myocardial infarction, MI, upon comprehensive postmortem and histologic evaluation. One half the long-accepted 80% prevalence among SCDs, according to Zian Sang, MD, MAS, of University of California, San Francisco, and colleagues of the post-SCD study. For the remaining 59% of autopsy-confirmed SCDs not traced to an MI, they can be explained by a range of causes including hypertensive heart disease, dilated cardiomyopathy, substance-related cardiomyopathy, and normal heart primary electrical disease. When an MI was involved, 9 in 10 cases were attributed to acute or healed MI with obstructive coronary artery disease, and 1 in 10 related to acute MI with non-obstructive coronary arteries, Minoka, 0.0. MedPage today. Asterisk cultivate joy every day. Everyone talks about a 1C, eating right, and checking your blood sugar, and that's important. But more important is to enjoy yourself, laugh, and be with people or pets you love. The more fun you have and the more you look forward to tomorrow, the easier it is to be good about medications, monitoring, and diet. WebMD. Key takeaways. Previous studies in children with cerebral malaria or severe malarial anemia have shown cognitive impairments 1 to 2 years after infection. A new analysis showed that cerebral malaria and severe malarial anemia were linked to long-term cognitive and academic deficits in survivors of severe childhood malaria. Children who had other forms of severe malaria had no significant differences in cognitive or academic scores compared with community children who didn't have malaria. MedPage today. Please hit the like button on this video, subscribe, and turn on notifications to stay updated on the fast-moving world of medicine. Thanks for watching, and see you tomorrow. Disclaimer: compiled information. The audience/viewers must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.